Now, the Christmas period can be a particularly challenging time for families who have problems with addictions, such as alcohol, drugs, even perhaps gambling. In fact, it's thought that 1 in 5 people is affected by someone else's substance abuse, with their needs often ignored. The Southern Health Trust, however, is addressing the problem with a family intervention service specifically for carers. Our health correspondent, Mary-Louise Connolly, has been to meet some of the people involved.
Whether it's alcohol or gambling, addiction is a huge problem across Northern Ireland. While focus is usually on the addict, the needs of the carer, perhaps a mother, father, brother or sister, often go unnoticed. The Southern Health Trust, however, are tackling the problem head-on. Families affected by drugs and alcohol misuse can independently avail of support, even if their loved one doesn't want to engage in the service. And that's what makes it unique. Among those taking part are Kathleen. Not her real name, we have changed it to protect her identity.
There was so much tension at home and unpredictability because we didn't know what was going to be happening from one day to the next. You didn't know what each day was going to bring, and it was a very fearful situation. You were always trying to respond and do your best to help the person because you loved them so much, but you didn't know what way to respond because you didn't know whether to bribe or plead or blackmail or tell them off or whatever.
In the past 18 months, 164 families have used the service, but that means over 200 people either receiving help over the phone or having face-to-face counselling. Kathleen tells me while everyone was worried about the addict in the house, she too was fighting her own demons.
Well, I couldn't eat. I'd lost my appetite and I lost a lot of weight. I also was sleeping very badly and there was a lot of interrupted sleep at night. The constant worry and fear and a sense of dread was always there with you, and feeling constantly on edge or walking on eggshells, wondering what was going to happen next.
The service, based in the grounds of Craigavon Area Hospital, is a lifeline to those who use it.
They worry a lot, they spend a lot of time at home wondering where that person is, what's going to happen whenever they return home, is there going to be arguments?
Fiona Kelly is the early intervention practitioner. She told me that drugs and alcohol cost society millions of pounds every year, but there's also the human cost to both the addict and their family.
It is a huge issue. 1 in 5 people are affected by somebody else's substance misuse, either directly or indirectly. For every one person that drinks, 4 people are affected by it.
And in what way? How can that impact on a home?
It can be very stressful, it can be financially stressful, there can be problems within the relationship, it can cause a lot of arguments, and for the family member themselves, it's very hard to concentrate on anything else whenever they're worrying about where the relative is and what they're doing.
According to Kathleen, the one-to-one intervention was invaluable. Seen by a practitioner once a week, within 3 to 4 months the sessions were gradually reduced. While Kathleen and her loved one were both receiving individual care, a practitioner was overseeing them as a family.
I would say not to be embarrassed, but to go and speak to somebody, maybe the GP, who can refer them to the service, who can put them in touch with the addictions team and then be signposted to the family support, because the family members, their needs and their health and well-being is of vital importance as well in keeping the family unit together.
Mary-Louise Connolly on a new intervention service for carers.